Here's the latest legislative news from the Texas Hospital Association, May 15, 2023. We're now on the other side of one of the session's major milestones, and THA has emerged in strong shape, particularly after months of galvanizing membership to stop dangerous legislation on government rate setting and hospital outpatient payments. Thursday night's midnight deadline for House bills to reach at least second reading brought an official end to some troublesome legislation, but the biggest defensive victories for THA came earlier in the week. Last Monday, House Bill 633 by Representative James Frank reached the House floor, but lawmakers raised several procedural points of order on the bill, prompting the author to ask for a postponement until well after session ends. HB 633, as constituted entering Monday, would have capped hospital outpatient payments for services provided outside of insurance at the lowest contracted rate the hospital had with any commercial health plan, a detriment to both hospitals and the insurance system, as it would have incentivized patients to be uninsured. Quickly following that news was another piece of addition by subtraction, as House Bill 5186 by Representative Greg Bonin wasn't set for Thursday's House calendar, meaning it wouldn't reach the House floor ahead of the midnight deadline. HB 5186 would have established a legislative committee to set payment rates for 4 state employee health plans. THA's main point of focus on Thursday night was making sure the central pieces of HB 633 and HB 5186 didn't rear their heads as 11th-hour amendments in other bills. Fortunately, that didn't come to pass. THA will continue keeping a close eye on legislation that remains alive, as well as possible budget riders, to identify and combat any resurrections of those or any other ill-advised tack-ons. That will include watching for a resurrection of House Bill 1692 by Representative Frank, which, as filed, would have banned hospital outpatient payments. The bill took on other troubling iterations after its original filing. HB 1692 also didn't make it past Thursday's House deadline. The bill and its Senate companion were the subject of repeated THA advocacy alerts that urged members to stunt the momentum of those bills. That companion, Senate Bill 1275 by Senator Kelly Hancock, is still alive, but has been stuck in committee since early April. THA will continue to watch it, as well as amendments or budget riders where a ban on outpatient payments might be resurrected. Another fortunate victim of the House deadline was House Bill 840 by Representative Gary Gates, which would have created a bundled pricing program in the Employees Retirement System of Texas. In a committee comment letter it submitted earlier this session, THA noted hospitals have seen bundled pricing setups lead to drastically reduced reimbursements. On the other hand, the advancement of the other 840 in this session was a big win last week for THA. Senate Bill 840 by Senator Royce West to make an assault on a hospital worker a third-degree felony was approved by the House by a 139-1 vote and is now ready for Governor Greg Abbott's signature. In reaching passage by both chambers, SB 840 joins Senate Bill 240 by Senator Donna Campbell and House sponsor Representative Donna Howard, a broader anti-workplace violence measure championed by THA that also is at Governor Abbott's desk. One THA-supported bill tied to hospital worker safety died with Thursday night's deadline, however. House Bill 4762 by Representative Suleiman Lalani would have given hospital workers liability protection for justifiably defending themselves through a use of force. The bill reached Thursday night's House calendar but did not get a reading that evening. In other activity last week, THA's bill to establish a state process for the federal Hospital at Home program took another step forward, with House Bill 1890 by Representative J.C. Jatan getting voted out by the Senate Committee on Health and Human Services. However, a THA-opposed bill introducing onerous and costly burdens on hospitals in the name of price transparency passed the House on Wednesday and is close to heading to the governor's desk. Senate Bill 490 by Senator Brian Hughes would require providers to accompany every request for payment from a patient with an itemized bill of services, which THA has warned would cause patient confusion and be an administrative and cost burden for hospitals. The Senate must sign off on a House amendment to the bill before it's eligible to receive the governor's signature. That amendment exempted physicians and federally qualified health centers from the bill. Also last week, THA attorneys testified in committees to back priority pieces of legislation for hospitals, with Associate General Counsel Cesar Lopez supporting House Bill 1236 by Representative Tom Oliverson to reinforce the prudent layperson standard for emergency care, and Assistant General Counsel Heather De La Garza testifying in support of Senate Bill 25 by Senator Lois Kolkhorst, which would establish wide-ranging state support for nurse faculty training. HB 1236 was heard in the Senate Committee on Health and Human Services, while the House Committee on Higher Education took up Senate Bill 25. Join us again next week for more updates from the 2023 session of the Texas Legislature.